Hi there, this is Brandon Owen. I just wanted to walk you guys today through a quick bonding exercise with the KLOwen bracket system. This is the one using the DIBS trays from OrthoSelect. And for the exercise, all I really need you guys to get is a curing light, some primer, a composite that you would normally use. This is going to be Transbond XT, and we're using the self-etch primer, but you don't need a self-etch primer for this exercise. Usually the primer will bond pretty well to these 3D printed models. And then just a cotton plier to load the brackets in. So the first thing I'll have you do is just use the cotton plier, and I want you just to kind of get a sense for the fit of the bracket. So the cotton plier is what we usually will use to kind of load the brackets into the IDB trays. One little trick too is if you have a loose bracket that's not staying very well in the IDB tray, one thing you can do is use a little bit of a silicone wax and actually take the occlusal, especially bracket wings, and just slide them through the silicone wax before loading that tray, and that silicone wax will actually lock it in really, really well. It wasn't an issue with this one, but just a really good trick in case you guys ended that problem right before bonding patients coming in. So then what we'll do is use a plastic instrument. You can also use a scaler for this. I really like something though with like these little plastic instruments. We just take a little bit of the composite onto that plastic instrument. And I like this because it fits the bracket shape really well, and it makes you kind of pad it in and butter it into that bracket base so the bracket really gets coated with that composite and it gets into the little mesh layers so it stays really well. And so I'm just grabbing a little tiny bit of composite here and just buttering it in. And the nice thing with these IDB trays from OrthoSelect is you can see the contour of the tooth, so you really have a good idea of how much composite you're going to need to add for each one of the brackets. And you can kind of see from looking from down from below, we have this nice contoured shape. So I'm just adding the composite to fill that just right. I've already loaded all the other brackets, so I just wanted you to see this last little bit, getting the last ones finalized. And I always find that the people, and rightfully so, end up usually adding a little bit more composite than they need for their first 4 or 5 cases, so you have a little bit more flash to clean up. But as you get through some of these bondings, you'll probably start finding that there's going to be less and less flash that you really are having to worry about, because you're just getting better and better with that positioning. So what I'll do next is I'm just going to take the primer and I'm going to paint the teeth. And one of the important things with this is the composite and the primers that we're using actually are very easily able to bond to these IDB trays themselves. So you don't want to try and get composite and primer everywhere, because it'll actually bond the tray to the teeth when you're bonding it in the patient's mouth. So you kind of just want to do the etch and the prime just right where the bracket position is going to need to be. And you can even look at the tray as you're doing this for the patient's mouth. So I'm just adding a little bit right in the center. And after you get that primer all added, I'm actually going to go in and light cure this just for about a second on each tooth. But what we're trying to do is just, if this is in the wet phase, when you put that tray on, it kind of spreads everywhere. So we're trying to make the primer a little bit tackier, so that it's not spreading everywhere and bonding more to that tray when you're shining the light with a composite on to activate the adhesive. So you're going to watch with this light. I'm just going to do a quick sweep around the arch just to start setting that primer. And now, a lot of times if you guys are doing the steps where the assistants are doing all of the bonding themselves, basically the best thing to do is just load all 3 of these trays simultaneously. So push them up into position. Put them in each quadrant. There's sextant if it's cut this way. And you just want to make sure, what I love about these trays is they fit the same place every time. So as long as you've got them seated, you know that the bracket's right where it belongs. And so I'll usually use a mirror handle or my finger and push from the occlusal, and then I'll use the light tip and actually put some pressure from the buccal. And I'm just going to do, initially when I'm setting this, if I'm the orthodontist sitting down, I still like to set the trays myself, and I'll just do a 3-second cure on each bracket, and then I'll let my staff come around and finish curing the adhesive completely. So usually as the orthodontist, I only have to be at the chair for about a minute because the assistant's already kind of seated this tray. The other thing you can do, if you want to, is after you've seated this tray before the doctor comes over, you can actually, if you have a periodontal probe, you can see if there's any excess composite, and you can actually do a sweep, a gingival sweep, and clear up some of that composite even before you do the light cure. So just another technique that you can do. So when the doctor comes over, he's literally, or she's literally just shining the light for 3 seconds per tooth. Other big etiquette for IDB is you want to wait to start shining the light until that light is seated in position, and you don't want to move it while you're curing because it'll actually affect the polymerization. So I'm going to turn it off, move to the next one. The other big thing that I always like to do when I'm doing IDB is I'll always either be on or just distal to the bracket I'm curing. So I've already cured this bracket, and then when I go to cure this one, I just want to make sure I'm not starting to cure the canine before that premolar is fully cured. So you can kind of see how I'm angling it a little bit to the distal, angling it a little bit to the distal, rather than this where I'm actually going to be curing now the central before I want to be curing the central. So try and keep that light always towards the direction of where you just came from. So you're not curing a bracket too early that you're going to move to next. Another thing that I've seen a lot of people do when they're doing indirect bonding is leave just the light on and then go and press, and then go and press. The problem is now that polymerization is affected because I don't have the bracket in the right position. I'm not holding that pressure before I start curing. So you want to make sure that the light is off. You get it situated, again, oriented towards the last tooth that you cured rather than towards the one that you haven't cured next. And that's the best technique, is light off, get it set, light on. So we're, again, headed from the tooth that we just headed to. I'm cheating that direction a little bit, so I'm not curing the premolar yet until I'm ready to, again, move the light tip and cure the adhesive. And on purpose, I'm not going to cure that last composite on the upper left 5 because I want to kind of show you what happens if you do get a bracket that doesn't stick during the bonding process. So you can kind of see, here's these ones have set really well. Peeling this bracket tray off, you can either kind of come from the gingival with a scaler. So this is a good way to kind of start slipping it up. And then I also come from the lingual, and you can go back and forth a little bit. The back and forth tends to minimize the ripping of the tray. So you can kind of see how it's coming off in all one nice clean piece. And you'll remember I didn't cure the 5, so that bracket hopefully is going to stick. Oh, and the 4 stuck too. So this is great. So what I want to show you is this person is still etched and primed. You can go ahead and go back in and etch and prime just again. And without having to go and clean up anything on the bracket itself, I'm just going to add a little bit more composite. So you've kind of now created a custom base, and now you're just going to fill in the gaps between where that tooth was where the surface of the tooth was and where there's a deficiency in the amount of composite that you used. So now I'm just adding this really quickly right back on. And the tray will always still fit because you haven't done any sort of tooth movement yet. So this same tray can be used to, at the bonding appointment, get that one of the brackets doesn't stick. You simply add a little bit more composite to that, self-etch primer, or primer the tooth, and then set the tray back on, and then light cure. And also, this is only with a 3-second cure. Normally, my assistants would come back around and do another 6 to 9 seconds per tooth, depending on which light we're using. Another really good technique after you get that initial one set is to come from the gingival, because at the gingival, you don't have the tray obscuring the light, so you'll actually get a better cure on the gingival with this. Some people will advocate going back around and then just doing a quick 3 seconds or 2 seconds to cure the rest of the composite. And if you have any bracket issues, like debond issues of the brackets that first month, you might want to start doing that. We typically haven't had to use that methodology, but now you can kind of see those brackets are all just right where we want them to be. Now, if this were a future visit, and so you can watch, if I had, imagine this central didn't come off, I just put the central bracket in, seat this back on. It still fits really well across all those other teeth, so you can still get that bracket bonded, even if that's the only one that didn't stick in the tray. But at a future visit after they've moved, we would just take a knife or a scalpel and cut the tray here and here, so none of the adjacent teeth were in the tray. You load the bracket, and then you can just do an individual segment to set it on that tooth. And I'll be showing that in some of the other future videos as well. So there's the bonding exercise for the OrthoSelect DIBS trays with the KLOwen custom bracket system. Thanks a lot.